Hello and welcome to the pod. I'm Nathan Fink.
I'm Jasmine Torres Allen, and this is New Hampshire Family Now,
a show about building family in the Granite State. Today in the pod, Jasmine and I discuss the meaning of public resources and how they stabilize families. And later we bring back two PCA America National Conference interviews, Dr. Renée Branch Canady and Andrew Russo. New Hampshire Family Now is brought to you by the New Hampshire Charitable Foundation. Since 1962, the Charitable Foundation has worked hand in hand with generous and visionary citizens to maximize the power of giving and support, collaborate, and lead innovative initiatives. Initiatives like New Hampshire Tomorrow, which is focused on making sure children and families have access to education, healthcare, and career pathways to ensure every family member thrives. To learn more about New Hampshire Charitable Foundation and all their initiatives, go to www.nhcf.org. This podcast was also brought to you by Family Support New Hampshire. Family Support New Hampshire is NH's coalition of family resource centers and family strengthening programs that exist to ensure Granite State families have access to resources so both caregivers and children can succeed, because supported families are strong families. To find a family resource center near you, visit www.fsnh.org. Hello and welcome to the podcast. I'm Nathan Fink.
I'm Jasmine.
Today on the show, we have two fantastic conversations from the 2023 PCA America National Conference that I wanted to bring back. But first, I know I say this every time I see you, it's been a while.
I know. At least it's nicer out today.
Yeah, it is. You have to catch me up, though, because I'm always looking for anything that I can borrow. How's the family? What are you up to?
Ooh, we're going through summer vacation. What are we going to do kind of thing? What's the next step? You know, that transition. And for both my kids, I'm going through the special education department process right now. And man, am I learning a lot. Like, I am learning a lot about like what requirements the state has and like what requirements schools have and, you know, where your child needs to be and, you know, all those things. And so I'm learning the process of it all. And this is where I really love educators, because educators, they educate me on the process of all these things. And I have such a deep appreciation for them, because they do take things step by step to make sure that I understand what's going on and how it works. Because it's a lot. It's a lot to go through a special education department and try to figure out, you know what your child's needs are and how they need to be met. And it can be overwhelming.
So how did you know that this was the path that you were about to go on?
I was struggling a lot more in my parenting than I think most parents normally do. And I didn't know that I was, though, because I was chalking it up to just, this is parenting and that's it. And I was in just sort of my own little bubble of like, this is parenting and I just have to be gentle and I have to do all this, all the rupture and repair and all that stuff. And it was the teachers at my, my daughter's school and, for my son, like, we've been through a couple of preschools, and it was those red flags from the educators that I saw that, okay, there are some things that are missing here. I didn't realize like how difficult it was for my daughter to make friends, and build those relationships. Right. And there was a while there where I was being that parent who was like, you know what, maybe she just needs a little extra help and she just needs to know like what to say and things like that. We would practice and I could see her improving, but she was still struggling. And so it was the teacher who was like, no, she's really struggling. Right. And it was like one of those hard moments, because you think about like your parenting and you start judging your own parenting.
Exactly.
You know what I mean?
Yeah,
because you think everybody else is judging you for your parenting, but sometimes you are your worst.
Well, that's it. It's the Taylor Swift song, man. I'm the problem. It's me.
Yeah.
It's so true. Yeah. That's amazing to me. Now, give me some of those things that you're actually learning.
Yeah, absolutely. I think patience is a practice that I have to keep practicing, because not all of this happens very quickly. Like once you decide, okay, we need to go down the special education route, or your child has more needs and they need to be met, there's a rush to get to making sure that all of those needs are met right away.
Right.
And sometimes that's not possible. That's not realistic. And there's a level of patience and like understanding that, there's a lack of staff sometimes, or, there's a process that you have to go through. And that can be really overwhelming. Like if you have to wait 60 days for evaluation, like that's a long time to wait. And it's a long time to sit in your brain and let it cycle and the thoughts start to go and you're like, what signs did I miss? And I really learned to like have a little bit more grace with myself and a little bit more patience practicing because I just wanted to immediately meet the needs of my kids.
Exactly. And it seems as it's very urgent for us as parents. These needs manifest, but I keep thinking about something Robin D. Almeida from Parent Information Center told me about bringing yourself to the table for conversation, but also honoring the fact that sitting at the table are other human beings who might be part of a process. And to move things, you have to be in relationship.
That's right. That was a big part too, because I was like, you know me, I'm a people person. So for me, it's very easy for me to just connect with people. And so sitting in a room full of people that, I'm not going to lie, I was a little intimidated because they have more education or they understand certain factors of the process more than I do. So it can be a little intimidating, but there's a sigh of relief when they start to talk to you in plain terms and like talk to you at your level. And that can help ease that anxiety of like, hey, this process is going to take 60 days, but here's what we're going to do in that 60 days. You know, they explained everything to me thoroughly. They answered my questions. They met with me at a time that was convenient. You know what I mean? Because I work full time, you know, so like it's one of those things where, okay, now we're all starting to build relationships and we're emailing with each other and, you know, they're starting to get to know, you know, my daughter more. And so, you know, what triggers her and things like that. And so
you're putting your team together, you know?
Exactly.
And when you have it, then you have it. And then you have your method. This is striking to me that we're talking about this because I'm kind of thrown back to that conversation we had with Jennifer Jones from PCA America about centering families in a system of support where they can thrive. And I think about that a lot because it can feel like we have this cultural narrative that essentially points at parents as if they were to blame. And, you know, I feel like a bad parent most days. You know what I mean?
Definitely.
And when our challenges arrive in our families, we point there that this is where that problem originated.
And there's a lot of times where I thought, is it my parenting? Is it me? Like, is it my parenting? And there were a lot of moments where, you know, the team that I have together now is like, they had to remind me, like, this isn't about your parenting. This is just what she needs.
Well, that's like a cultural perspective too, that we think these children come out empty vessels. And that it is part of our filling their cup. You know, and rightfully so. I mean, when I say that, I can see this sides. Like children do parrot kind of what we provide. And I can hear that when I tell my son his bedtime, the things he says. But I'm also, he came out with a personality. He came out with a perspective. He came out with a certain, you know, neuro arrangement.
And sometimes we forget that too, right? Because they still make their own decisions despite what you see and what you view as your parenting. And, you know, I'll tell you what, though, the level of patience that I've learned to practice as a result of the process and understanding, you know, how to meet a child with special needs, like what their needs are, has been a really eye-opening process.
You know, I think what we mean by that is that parents actually are the solution because what we need to do is bring ourselves into this partner mindset. You know what I mean? You see a parent who's struggling, and this is all about prevention, right? And even sometimes I'll catch myself, like the things that I say, you know, about my parenting or, you know, how I am at home. I have to be careful about the things I say out loud too, because sometimes they're not necessarily true, but because we say them out loud, we convince ourselves that it's true. What you don't realize is that you can change those factors, even if it's slow. You know what I mean? Like, okay, maybe it is my parenting, and there's something I hadn't learned. There's a missing piece. And I just need someone who's not going to judge me and say, hey, there's a piece right here. Have you seen it? Well, that's personal mindset shift. And I mean, I've heard it too. We recently hosted a legislative breakfast where we were talking about prevention, and a longtime supporter walked by, gave us the thumbs up and said, some people just shouldn't have children. my frame was to not, because I know that I've heard that statement before. But then it occurred to me that she was talking about me. I shouldn't have had children. I know nothing about this world. You and I have talked about this. Are you ever really ready?
Yes, that's true.
Right.
Yeah.
So that means, though, that it is a learnable skill.
Yeah.
And I think, though, if we think about that, then all of a sudden, all these ideas to me about the public good come up, because research tells us this over and over again. People do as well as the environment that you put them in.
That's right.
So when you think about that, then that gives us something to lean into around this idea of environment. This is about public good. This is an ecosystem.
That's right.
And at PBS, the Public Broadcasting Service, I wanted to ask you what you thought when you hear the word public.
Yeah. I mean, public media is a public service, and it's meant to show us all kinds of educational content that has the ability to improve the quality of our lives. So, we spend a lot of time consuming content, and maybe you're a parent and you consume a lot of parent content. Maybe it's negative, maybe it's positive, maybe it's funny, right? But in the public media space, there is an ability to create educational content that has the possibility to even improve someone's quality of life just a little bit. Just from that little bit of knowledge, right? Because sometimes just having that missing piece of knowledge, you're like, it clicks.
And you can't talk about public good without talking about public health, which is critical when we're pursuing these ecosystems of family support. And I wanted to pivot to a conversation I had at PCA America's 2023 National Conference with Dr. Renée Branch Canady, CEO of the Michigan Public Health Institute. Let's take a listen.
Thank you, Nathan. Great to be with you.
So I want to start in kind of this broader place with public health. Why is it so critical for the population as a whole?
Well, of course, we had that very explicit demonstration of why public health is important with the COVID pandemic. But even pre-COVID, our mission in public health is to assure the conditions necessary for good health. And oftentimes when I think about good health, I don't think clinical, biological, physiological well-being. I think about the broad well-being, educational well-being, relational well-being, employment well-being. And so it really is about how do we structure our lives in this society where the healthy choice is the easy choice for everyone.
Now, when you say everyone, this is something I've been thinking about for a while, because throughout my life, public health, when I hear it now, I think it's all inclusive, but it's not all inclusive. So what are our opportunities to make it more inclusive so everybody can thrive the way you're describing?
Well, we do know that people living in more vulnerable circumstances in terms of their housing or economic are going to be exposed to greater threats to their health and well-being. And so as a profession, public health leaned toward those folk living in vulnerable circumstances. And I'm intentionally saying it that way, not saying vulnerable populations, because if we took those families and put them in well-resourced environments, they would do wonderfully. And so that's been the attention for public health, but it has not been our exclusive responsibility. And getting people to understand that we all are a part of the public in public health is an important responsibility that I think we have as professionals in the field.
That means we have to make certain investments. What are some of the investments that we need to be making so to ensure?
Well, right now, everybody's using the vernacular of equity, but not really thinking about what does that deeply mean. So I love your question about investments, because I think for this to be one of, if not the most well-resourced nation in the world, to have health metrics that are deplorable, not just for people of color. If we look at infant mortality rates internationally, white women fare terribly when compared to other nations, and Black and brown women in the United States happen to be doing worse than women who are internationally doing worse. So it's this additive effect. So how do we begin to look at systems and structures that have not fared families and, dare I say, children well? Our responsibility is to those, the next generation, right? And we've just not done that well. We have the ability to do it. We have the ability to assure that everyone can be their best, most healthy self, free of the scourges of poverty, free of the scourges of racism and discrimination and bias, free of the scourges of gender oppression and all the ways that we so often other people in this sort of hierarchy of what relationships we value and what relationships we minimize. So thinking differently about the structures, the relationships of the structures, making investments in those things, both education systems, health systems, et cetera, et cetera.
Yeah. Now, as we advance toward wellness, as we kind of continue this march toward better environments for all people, what things do we need to be cognizant of as we build these structures so to make sure that they are forever listening, forever inclusive?
Part of my remarks this morning were about us as leaders. We tend to sort of reify institutions, and I'm a public health professional, and I'm also a medical sociologist by training, and we sort of look and say, well, the department wasn't very helpful. Really? The whole big building had a mouth and decided we're not? How do we stop reifying institutions and recognize that institutions are filled with employees that we are trying to push to be equity leaders and change agents, to say, that's not a policy that's benefiting all of us, or this policy is disadvantaging this unique group, and change has to be made.
Yeah, reminding us that there are systems, that it's made of us, for us. And if it's not working, why are we doing it?
Absolutely. Absolutely.
I'd love to know what stood out to you about that interview.
What really stood out about that interview was, the making the healthy choices easy for everybody. Mm-hmm. Because I realized I was like, sometimes making the healthy choice is really hard,
right?
And like sometimes you feel like you have to make the unhealthy choice in order to eventually get to the healthy choice, right? And prevention, in order for it to be equitable, it has to be the healthy choice is easy for everybody to make the first time around.
Yeah, it's so true. And, if to invest then in a public good where there is an ecosystem that is healthy, we have to value the thing in the ecosystem.
That's right.
The idea, though, I think is really important because we had a recent conversation about placing families at the center of the ecosystem. Mm-hmm. And the assumption was we actually value families. And our impact director, Becky Burke, stood up and she was like, I'm sorry, can we talk about whether or not we value families? And she says, okay, New Hampshire just released numbers around pay equity. She says, we also know from our family support data system that the vast majority of families visiting family resource centers are female-led households. When we know from that earlier study that I mentioned that females make 73 cents to the dollar compared to their male counterparts.
Right.
If you're a woman of color, it's actually 63 cents.
Yeah, it's less.
So let me ask again, if those numbers stand, do we value families?
I don't know. Those numbers are a little tricky.
Yeah, right. You know what? We need to take a break.
Okay.
But when we come back, we'll have more with Jasmine. Today's show was brought to you by Bank of New Hampshire. For 193 years, Bank of New Hampshire has put customers and communities first. With the expertise to help you realize your goals, their technology makes banking easier, and the friendly faces will make you want to visit in person. Want a bank that has your back? Bank of New Hampshire are your people. For more information, visit bnh.bank or call 1-800-832-0912. Member FDIC. Today's podcast was brought to you by Dartmouth Health Children's. As the only comprehensive pediatric healthcare system in the region, Dartmouth Health Children's promotes health, advances knowledge, and delivers the best patient and family-centered care for infants, children, and adolescents. Shared knowledge from expert providers across the system increases their ability to care for patients and families close to home. From annual checkups to specialized treatments, Dartmouth Health Children's is dedicated to ensuring all children live their happiest, healthiest lives. For more information, visit childrensdartmouthhealth.org. That's childrens.dartmouth-health.org. Merrimack County Savings Bank, where Merrimack style is treating everyone with care, respect, and compassion, proudly supports the mission and efforts of New Hampshire Children's Trust. Founded in 1867, the Merrimack has served people, businesses, nonprofits, and municipalities in central and southern New Hampshire for over 157 years. Visit local offices in Bow, Concord, Contoocook, Hooksett, Nashua, and Windham, or go to themerrimack.com. Welcome back to the show. As you may remember, we were just discussing public good, which of course includes public health as well as public information, and this idea around mindset shifts in families. And another key component of public resources is where we can connect with others and find help or a hand up in challenging times. Now, we just started talking about your experience with the special education system. So when you're talking to these individuals, there's a lot to know. So in those moments for you, where do you turn when you get stuck?
Oof, that's a really good question, because there is a lot of information to process. And sometimes if you don't know what questions to ask, that can be really, really tough. Sometimes I feel like I might be asking a dumb question, but I turn a lot to the family support network that's in Nashua, and it's really a group of parents that support each other on an every other week basis. And we meet for like parent cafes and things like that. And we talk about really deep topics. Sometimes it involves our kids, sometimes it involves ourselves. And but having those conversations makes me feel so much more human, because I don't feel alone. And that in itself helps so much. Yeah. And when there's another parent who sees me struggling with my kids in public and they're like, I totally get it.
Right.
You do you. You know what I mean? Like those moments help me like breathe out a little bit more, because, I get very sensitive sometimes, and I'm out in public and my kids are bouncing all over the walls and I don't know how to control it. Right. Yeah. Or in that moment, I'm just like, I'm at my capacity. And so those connections with other parents or other families who understand what I'm going through, or, understand when, the kids are on a sugar high, you know what I mean? And they give me that space to just be human. Like, hey, we're in the struggle bus together. Yeah. It's okay, And so those moments help me feel like I'm human. And then it allows me to process a little bit better what I'm going through. And like, even with my husband, like he's going through his own things and he's not understanding and he's processing. And if we're the only two people processing on each other, man, that's really difficult. You know what I mean?
Help. And I'm so glad you mentioned that, because as you talk about the education system, I think too, that's one system. Yeah. We navigate all these different systems, all these different experiences over and over again. And, when I think about the family support network in New Hampshire, I get super grateful, because you have these family resource centers stationed in different parts of the states. And then you have the coalitions that you had mentioned, the different networks. And I'm fascinated because these act as little libraries.
They do. They really do.
Family libraries.
And they create like events and things like that help people participate in community life. And sometimes when you're in your own little parenting bubble and you create your little community at home, you don't leave that little community and you don't know, what's available to you. And then when you have all of these family resource centers creating spaces for families to engage with each other, then it helps you leave your little community bubble you've built at home and see that there's a bigger bubble with more people who understand exactly what you're going through in your own little bubble.
Exactly. And that's where I was fascinated. I had no idea the origin stories of family resource centers in the United States and how they were involved with, immigration and things. And actually, I should just play an interview from Andrew Russo, the co-founder and director of the National Family Support Network. He does a great job of talking about that. Let's take a listen.
Well, first and foremost, family resource centers are welcoming hubs of support for families, and they provide supports and services and opportunities for families to make connections with each other. And these centers provide services at no cost or low cost for participants, and they're designed for everyone, with the idea that raising children, being a spouse or partner, are two of the most difficult jobs we can have as adults. two of the most difficult jobs we can have that we typically receive nothing in the way of support for. So that's where family resource centers come in to help us succeed with these important roles in our society. So family resource centers, therefore, do not have stigma attached with them because they're for everyone, and are programs that people can feel comfortable accessing in their communities without judgment to access support and build relationships.
So family resource centers really have evolved over the years to be what they are today. What is it about their origins that makes them such an embedded part of the community?
Well, I think to look back at the history of family resource centers in this country goes back to the turn of the last century when immigrants were coming to this country in large numbers, primarily from Europe, and settlement houses sprung up in large metropolitan areas like Boston, New York, Chicago, San Francisco to help those new immigrants acclimate to life in this new country. So my own ancestors on both sides would have availed themselves of services and supports at settlement houses in Boston, my hometown. And they provided English as a second language classes and job skills training and information about navigating the new society, and also opportunities for people to preserve their home cultures. And then the modern day incarnation of the settlement house framework is the family resource center. So there are literally settlement houses, such as in San Francisco, that are now family resource centers, continuing to serve the community in the exact same physical location, including some of those supports and services that are exactly the same as over 100 years ago. English classes, job skills training. But now we would also see the emphasis on things we know support healthy families development. So that parenting support and access to resources around having healthy and successful families. So I think in part, the strength of family resource centers is they go back to a model that's over 100 years old and works. And because there's that strength there, they've continued to build and innovate and evolve over time. But the concept is still the same. The idea that you're supportive of communities in communities. And the really key piece is we talk about the programs being of, by, and for the communities they served. So parents, community members, caregivers are involved from the very beginning in developing a center in terms of informing what are the challenges, what are the opportunities in the neighborhood, what then would the center reflect in its programming to support that particular community. So we often say if you've seen one family resource center, you've seen one family resource center because they're developed in response to their individual communities. And then families are engaged in the programming, families are engaged in leadership in the program through the Parent Advisory Committee that continues to guide the work and ensure that the program is accountable to the community in achieving its outcomes. So that deep groundedness in community is a key strength of family resource centers, and that flexibility to be responsive to different kinds of communities has also been part of their success. And the other key piece to mention is the focus on building supportive relationships. So there are a lot of supports and services for families out there, but I always try to explain to folks that going to a family resource center is totally different than going to the dentist office. You know, you go to the dentist office and you go back 6 months later. I hope you don't have to go back any sooner than that. And, you know, you get your services and may have pleasant interaction with the people there, but that's it. Going to a family resource center is a totally different experience because not only do you access supports and services, but you connect with other parents and caregivers. And family resource centers create the physical place for families to get to know each other, to build that all-important protective factor of social connections. And social connections are that secret sauce of the strength of family resource centers that ensure that families have positive experiences in them, like connecting with other families, knowing they're not alone, that there are other folks to form friendships with who then can help out in a pinch with childcare or making a recommendation about a good place to find a pediatric dentist and things like that, keeping the dental theme going here. So that's a key part of, I would say all of those are key parts of what make family resource centers successful and how they've developed over the years, because the framework itself is so flexible and so deeply grounded in the community.
Now, organizations like family resource centers that provide this support that looks like us, that feels like us, that is us, creates strength. But certainly they need to be strengthened by the communities themselves. So what are some of the challenges that a family resource center itself would face or is facing in this climate?
I think if you asked in general, people working at family resource centers, the challenges they face, the first thing they would point to is funding, because there is no dedicated federal funding for FRCs. So they're not like Head Start programs or after school programs or home visiting programs, all of which have dedicated federal funding, all of which have whole systems behind them organized that the programs roll out across the different states. Family Resource Center world is totally different. The work has emerged organically as so many different states, counties, municipalities, towns have chosen to invest in these family resource centers when nobody's telling them that they have to. And that's wonderful. And it also creates such a patchwork of what the landscape looks like, what are the right funding levels for FRCs and how do you determine what those should be? When you look at, again, the variety of services they provide and the different landscapes that they're in, there's no one answer to that because cost of living are different from place to place. But overall, I would say as a field, family resource centers were under the radar to begin with, and then things such as wages and benefits and such were really far down the list in terms of things that were even talked about even amongst FRCs. If they talked about funding, it was funding to support more work with the community. Only now are we seeing networks of FRCs and the national network itself turn to issues such as, now how do we ensure that the workforce is well supported and compensated? Because we're only as good as our people, as simple as that. All the work is relational. It's all people-based work. So we need a strong workforce skilled in supporting those helping relationships with families, which means we need to pay attention to paying living wages that workers themselves are not struggling with their families in order to do this work with the community. So I think that's been one of the key neglected areas that is getting more attention now, and one that we plan to continue focusing attention on. Other fields like early care and education are so much farther ahead of us in terms of their advocacy, their strong voice, their making the connection with support for the staff and what difference that makes in terms of care for children. A family resource center world is playing catch up with that.
So as the co-founder and director of the National Family Support Network, what then, given those challenges, are some of the opportunities that you're seeing to carry on these conversations?
I think there are a number of opportunities out there. The first one I would point to is the incredible job that FRCs did responding to families' challenges during the pandemic. And that was FRCs doing what they do best, which is ensuring that communities are supported. And even when everything else shut down, you could count on a family resource center in your community having its lights on, doors open, doing whatever they could to support the community, even at the most challenging times in our country's recent history. And with that, what we saw was FRCs in a situation where all families needed support, all families needed resources. Family resource centers stepped up, rolled up their sleeves, redoubled, retripled, requadrupled their work to support the community. And what was different was it was noticed. And for the first time, family resource centers started to get on the radar in various states. And it was Alabama in May of 2020 that was the first state that stepped forward and said, hey, what these centers are doing is really impressive. And they had long had a network and they had long had centers, but they stepped up their financial support of them. They increased the funding for FRCs, recognizing that FRCs are really helpful to have around. And not just in times of crisis, but in general. And they were rapidly followed by states red and blue across the country. And the ARPA funding helped with that in some situations. And also even without additional funding, states and cities and counties dove deeper into their resources to support these centers. So that alone created an incredible opportunity where we have seen an unprecedented influx of funding into FRCs that we've never seen before. We've never seen anything like that. And just within the past 3 years, and that has continued unabated. There are more and more states investing in FRCs, more and more networks coming online, and that creates a great opportunity to further connect the work and ensure that all families will be supported. That our vision is that you wouldn't think twice about there being an FRC in your community, just like there should be a park and a library and a good school. They're just building blocks of healthy communities. So with that opportunity, with so much attention on FRCs, which is new for us, we're not used to the attention, as you mentioned, typically being under the radar. What do we do with that moment? And what is it that we want to put forward as the things that governments and systems leaders can pay attention to as they're trying to support families through investing in family resource centers?
So when you hear Andrew, is there anything from that interview that stood out to you?
Well, he said something about how, if there's one family resource center in that community and it serves that community well, then that's, that right there is proof that family resource center is doing the job that it needs to do. It's serving its actual community. The example I love to use is the Arlington Street Community Center in Nashua. It serves that neighborhood extremely well, and it provides events, it provides a free space, it provides a free preschool.
Right.
You know what I mean? It understands very well the community needs because the people who are from there run those things. So it's community led, and then it goes right into the family resource centers. Right? It's people who live in those communities who really understand what those needs are, and maybe are going through some of those same necessities as well.
Right.
So they understand those systems a little bit better.
It's kind of, not to keep mixing metaphors, but it's like those little bodegas. I don't know, but straight up, these little hubs of understanding what people need.
Yes.
I love it, you know, and I think it's so important to have. And because they arise out of their own community's need, they have a very authentic look and feel. And, I'm grateful that they exist and that they continue to exist. And I hope, in the future that this is something that we can really get behind, because to create an ecosystem that really puts family at the center, you got to know what you're going through.
Absolutely.
Got to know where to go.
You have to know your people. I always say the best community workers are indigenous to their communities.
Yeah.
And so they understand their people. They understand the families around them. They go to school with your kids. They understand those needs, and having those people lead the conversations and putting those families at the center of their community needs at those family resource centers helps a lot.
Speaking of knowing what you need, I think I owe you bus fare for the struggle bus.
That's okay. Catch me on the next one.
I will. This podcast was brought to you by Nixon Peabody, who delivers exceptional legal services for clients in the community by combining high performance, an entrepreneurial spirit, deep engagement, and an unwavering commitment to a culture of collaboration, diversity, and humanity. Nixon Peabody works with universities, hospitals, and nonprofits of every size to maximize impact. For more information, visit nixonpeabody.com. Many thanks to the Samuel P. Hunt Foundation for sponsoring this podcast. Established in 1951, Samuel P. Hunt Foundation is a Manchester-based, independent nonprofit that provides grants primarily for the arts, children and youth services, faith-based organizations, educational institutions, healthcare, and human services. New Hampshire Family Now is listed on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, iHeartRadio, and more. Listen wherever you get your podcasts, or ask your smart speaker to play New Hampshire Family Now.